We sometimes feel things that seem normal, a little more tired than usual or a small ache here and there. But what if these signs aren't just because you're getting older? What if they are your body's way of warning you about something more serious? As we get older, especially after 65, our bodies might start giving us subtle signals that shouldn't be ignored. In fact, these signs could be a sign of something dangerous, and acting on them quickly can make all the difference. Fatigue is something everyone experiences from time to time, whether due to a poor night's sleep, a busy day, or stress. However, extreme fatigue is different. It's when the tiredness feels constant and overwhelming, even after a full night of rest. You may feel exhausted after doing everyday tasks, like walking to the mailbox, getting dressed, or cooking a meal. This isn't just about being older or having a busier lifestyle. This kind of fatigue could be a warning that something inside your body is not working as it should. It might be a sign that your heart, kidneys, or immune system are under stress. If these organs aren't functioning properly, your body uses more energy to try and keep up, leaving you feeling drained. In many cases, extreme fatigue can be an early sign of serious conditions like heart disease, cancer, or kidney failure. These conditions often don't show obvious symptoms right away, and fatigue can be one of the first signs. If you're experiencing this kind of fatigue for days or weeks, and it's making it hard for you to enjoy the activities you once loved, don't wait. Make an appointment with your doctor, ask for blood work and a full physical exam. Early detection can be key to managing the condition and protecting your overall health. Number 2. Sudden chest pain or pressure. Act fast. Chest pain is a symptom that always demands attention. It's often linked to heart-related issues, and the risks can be life-threatening if not addressed immediately. Sudden chest pain, especially if it feels like pressure or tightness, could be a sign of a heart attack, or even something more dangerous like an aortic dissection, where the body's main artery tears. Many people mistakenly think chest pain is just heartburn or muscle strain, but this isn't something to brush off. If the pain is severe, sudden, and spreads to your arm, neck, or jaw, this could be a heart attack. Heart attacks don't always feel dramatic. Sometimes the pain is subtle at first, a mild discomfort or tightness in the chest that gradually gets worse. You might also experience shortness of breath, dizziness, nausea, or cold sweats. It's important to act fast. If you experience chest pain, don't wait. Call 911 immediately. The sooner emergency responders can start helping you, the better your chances of survival and a full recovery. I want to make a request. Please subscribe for more health tips and advice. I'm here to support you, so don't miss out. Hit the subscribe button now. Number 3. Shortness of breath. When breathing becomes a struggle. Breathing is something we rarely think about until it becomes difficult. If you suddenly find yourself out of breath while doing simple tasks, like climbing stairs, walking around the house, or even when you're sitting still, this can be a serious warning sign. Shortness of breath, or difficulty breathing, is not just a normal part of aging. It may signal an underlying health problem. For older adults, shortness of breath can be caused by several conditions, including heart failure, a blood clot in the lungs, pulmonary embolism, or even a silent heart attack. Heart failure happens when the heart isn't pumping blood effectively, which can cause fluid buildup in the lungs and make it difficult to breathe, especially when lying down. Pulmonary embolism occurs when a blood clot blocks a blood vessel in the lungs, leading to sudden breathlessness and a feeling of suffocation. In some cases, shortness of breath might be the only symptom of a heart attack, so it's crucial not to ignore it. If you experience sudden or severe shortness of breath, or if you're gasping for air even after minimal exertion, it's important to seek medical attention immediately. The sooner you address this symptom, the better your chances of receiving treatment and preventing serious complications. Number 4. Unexplained weight loss. A sign of something serious. While gradual weight loss might be expected with aging, sudden, unexplained weight loss, especially if you haven't made changes to your diet or exercise routine, is a major warning sign that something is wrong. If you lose more than 5% of your body weight in 6 months without trying, it could point to a serious underlying health issue. Unexplained weight loss is often associated with serious conditions such as cancer, heart disease, hypothyroidism, or chronic infections. Cancers like those in the pancreas, lungs, or digestive system often cause rapid weight loss. because they interfere with how the body processes food and uses energy. Other conditions like diabetes, hypothyroidism, where the thyroid is overactive, or even digestive diseases that prevent your body from absorbing nutrients properly can also result in weight loss. It's important not to ignore these changes. If you notice your clothes fitting differently, your belt needing more notches, or your weight dropping without any effort, it's essential to see your doctor for a full evaluation. Detecting the cause of the weight loss early can lead to better treatment options and improve your chances of recovery. Number 5. Confusion and personality changes. A warning for your brain. Sudden confusion, memory problems, or personality changes can be alarming, especially when they happen quickly or without warning. If you suddenly find yourself forgetting where you are, not remembering things you should, or feeling lost in familiar surroundings, it's not just a sign of getting older. These kinds of cognitive changes could point to more serious health problems affecting your brain. One possibility is a stroke or a mini-stroke, also called a transient ischemic attack, or TIA. A stroke can cause sudden confusion, difficulty speaking, and memory issues, and these symptoms can happen quickly, sometimes within minutes. A mini-stroke is a warning sign that a larger stroke could occur soon, so it's essential to seek medical help right away. Other causes of confusion or sudden changes in personality include infections, such as urinary tract infections, UTIs, which can lead to delirium, especially in older adults. Infections don't always present with fever in seniors, but they can cause significant mental fog, agitation, or confusion. Sepsis, a severe body-wide infection, can also cause confusion before physical symptoms like fever appear. Dementia or other neurological conditions, such as Alzheimer's disease, can lead to personality changes, but these usually happen gradually over time. Sudden or dramatic changes should not be dismissed as just aging or forgetfulness. If someone you care for begins to act unusually confused, irritable, or forgetful, it's crucial to get medical attention quickly. Early intervention may slow the progression of some neurological conditions and help address any underlying issues. Number 6. Severe abdominal pain, more than just an upset stomach. It's common to experience occasional abdominal discomfort, maybe from eating too much, gas, or an upset stomach. But severe and persistent abdominal pain that doesn't go away, especially if it worsens over time, is not something you should ignore. It could be a sign of a more serious health condition, one that needs immediate medical attention. There are several serious causes of abdominal pain in older adults. One of the most dangerous is a ruptured abdominal aortic aneurysm. The aorta is the large artery that carries blood from the heart to the rest of the body, and it runs through the abdomen. If it weakens and bursts, it can cause severe tearing or pulsing pain in the abdomen and lower back. This is a life-threatening emergency because it leads to severe internal bleeding. Immediate medical intervention is essential. Another serious cause of abdominal pain is intestinal ischemia, which occurs when the blood flow to the intestines is cut off, often by a blood clot. This causes severe pain, bloating, nausea, and even the inability to pass gas or stool. Pancreatitis, which is inflammation of the pancreas, and gallbladder attacks can also cause sharp, persistent abdominal pain, often radiating to the back or worsening after eating. If you experience severe abdominal pain that lasts for hours, and especially if it is accompanied by vomiting, fever, dizziness, or a swollen belly, don't wait. Go to the emergency room right away. It's better to have it checked out and find out it's nothing serious than to wait and risk worsening complications that could be life-threatening. Taking care of your health is more than just reacting to symptoms when they arise. It's about building habits that support a long, healthy life. Here are a few bonus tips to help you stay ahead of potential health issues. Number 1. Stay active. Regular physical activity, even something as simple as daily walking, keeps your heart, muscles, and joints strong. It also improves circulation, reduces stress, and boosts your overall mood. Aim for at least 30 minutes of moderate activity most days of the week. Number 2. Eat a balanced diet. Eating plenty of fruits, vegetables, lean proteins, and whole grains helps keep your body fueled and healthy. Make sure you're getting enough calcium and vitamin D to support bone health, And stay hydrated by drinking plenty of water throughout the day. Number 3. Schedule regular checkups. Regular visits to your doctor, even if you feel fine, are essential. They can catch underlying issues before they become serious. Make sure to schedule annual screenings, blood tests, and other preventive measures. Number 4. Know your family history. Being aware of your family's medical history can help you understand your own health risks. If certain conditions run in your family, make sure your doctor is aware so they can monitor you more closely. Number 5. Manage stress. Chronic stress can take a toll on your body and mind. Practice relaxation techniques like deep breathing, yoga, or meditation to reduce stress and improve your mental health. As you age, your body changes, and it's easy to dismiss new symptoms as a normal part of getting older. But your body is constantly sending signals, some subtle, some more obvious, when something isn't right. Symptoms like extreme fatigue, chest pain, shortness of breath, unexplained weight loss, confusion, and persistent abdominal pain are often warning signs that should never be ignored. While it may be tempting to brush off discomfort or assume it's just part of aging, early detection can make a world of difference. Ignoring these symptoms could delay diagnosis and treatment, leading to more severe health issues down the line. On the other hand, paying attention to these warning signs and seeking medical advice early can help you manage or even prevent serious conditions, ensuring that you live a longer and healthier life. Trust your instincts. If something feels off, don't hesitate to schedule a doctor's appointment. Listen to your body's whispers before they become shouts. Taking care of your health isn't just about reacting to illness. It's about staying proactive, informed, and empowered. Your health is a precious gift, and by paying attention to these red flags and seeking help when needed, you can protect your independence, maintain a high quality of life, and enjoy the things you love for years to come.